Hi, Carson, and welcome to Catching Jobs. Thanks for joining me today. So today we're here just to talk about your. Come closer. There we go. So today we're just here. We can touch knees. So you're all about your side job. So you work here at the fire department.
Mm-hmm.
And funny story is, I hated you when I met you.
Yeah, I know.
I tell everybody this. I have to give people a chance because you came and then you. What's a good word for you?
I mouthed off.
Yeah.
I've been doing it ever since.
Yeah, exactly. And but then now I love you, and you're one of my favorite people. So,
well, shucks.
So why don't you start with how you got into the fire service?
So the way I got into the fire service is kind of weird, and it almost is like, so in high school, I was kind of like a shithead. I don't know, can we cuss on this?
Yeah,
okay.
Oh yeah.
Okay. I was kind of a shithead in high school, like didn't do my homework. I graduated high school with 1.9 GPA.
Nice.
Which
is surprising because you're smart.
I actually shouldn't have been allowed to graduate high school. I think they just didn't, because they didn't pass a class.
Yeah.
I got an F. And I think they were just like, send him through, retired him. But in high school, I had the opportunity to do concurrent enrollment through the local community college. Mm-hmm. And one of the offerings was for the EMT basic class.
Yeah.
And the EMT basic class runs from 6 to 9 p.m. But I could slot it in my schedule at the high school and just get a free period out of it.
Oh.
So that's why I did it initially.
Yeah.
Because it looked interesting and I could have a 3-hour long lunch.
Okay.
If I did that.
Yeah.
So, and I started going to class, obviously.
That makes sense that you would do that.
Yeah. I started going to class and I absolutely loved it. Like, I just enthralled by it. It was so interesting to me, and I'd never really considered much about like EMS, fire, like being in that role, and I loved it. Mm-hmm. And the instructor was a lieutenant at the local fire department, and they have small town, Sterling. Mm-hmm. They have a part-time EMT job that they had open, and he encouraged me to apply for it, and I did. And so started working as a part-time EMT at the fire department, and then was like, oh yeah, this is it.
Nice.
And so went through their fire academy that they had, and got my firefighter. Went through paramedic school. I think a year later, and because I loved it. Like I loved being an EMT, being a firefighter, and I knew I wanted to be a paramedic, so I went through paramedic school, and then shortly after got hired up here in the Denver area. Small department, and that's how I ended up here as a lateral.
Nice. That totally makes sense because you're like, I don't want to say manipulative. You're very.
I'm scheming.
Yes, exactly. Yeah. Okay, so you now also work at a hospital.
Yeah, so I worked as a paramedic. I got hired at Fed Heights in 2019 when I got my paramedic. I worked there for a few years, and I love being a paramedic. But I just wanted more education, more like scope. I just wanted more, to learn more. And so I went through Creighton University's critical care flight paramedic course. And got my critical care endorsement, mostly just because I wanted to learn more, it's just continue expanding my knowledge. And so I got my endorsement on my state license, and shortly after, I knew that there was this position available at the hospital downtown that they have techs and they have hospital paramedics. The hospital paramedic role, they require 2 years of previous paramedic experience, running calls, and preferred qualification, which I think everyone has it there that's a paramedic there. You have to have your critical care endorsement.
Okay.
And I did, so I applied for it, and it was just PRN, and it's a really cool role. So I get to work. Most ERs, paramedics that work in the ER work as a tech. they start IVs, they do the basic stuff, vitals. Some places maybe allow them to give like 10 medications. So like your Zofran, your morphine. But this role is an expanded scope paramedic practice. So I don't work at like below a nurse. I work alongside. So it's essentially a nursing role. So I will take a patient assignment. I'm the patient's primary nurse for all intents and purposes. Work under the direction of a physician, but still get to do a lot of the paramedic skills too. I can intubate someone in the ER under the supervision of a physician. I can give, there's only like 6 medications or procedures I'm not allowed to do. One of them is enemas.
So that's okay.
So that's okay with me. Yeah. It's like the literally the shitty stuff I can't do. I'm not allowed to give rectal meds. Like, whoever wrote my scope was looking out for us. So yeah, it's a really cool role.
Nice. So how many shifts do you work? You work 48 hours here, and then you have 96 hours off. So what does it like a 96 look like for you?
It depends. So now that I have moved out to the country, I started my homestead.
2 hours away.
2 hours away. I don't work as much as I used to. Sometimes I would do two ER shifts every 4 day. Well, when I first started, the money was like really good. Like it was really good, more than I was making an hour when I was at Fed Heights by a long shot, because they were so low on nurses. I mean, this is 2021, 2022-ish. Right after COVID, there's all the hospitals are hurting for staff. Everyone's traveled. All the nurses are traveling. So they gave some pretty good incentives to the tune of like $75 an hour.
Oh, nice.
To pick up a 12-hour shift.
Yeah.
So I was working a lot then to try and just hustle some money.
Yeah.
I actually that year I made more than I currently make now on my like taxes, because I was just hustling.
Yeah.
But as I've I love it still, but I've kind of slowed down how many shifts I'm working. So I'll maybe work one shift every 4 day, or if I have a trip planned, I won't work 1 4 day. My requirement is, I think, 6 shifts every 6 to 8 weeks, somewhere in that range. Yeah, so it's 1 shift a week is the requirement, but if I do 2 shifts in a week, I could take the next 2 weeks and not work a shift. So that's just 1 extra day. Usually what I do is, since I live so far away, I'll schedule my ER shifts the night before or the day before we go on shift, and then just either stay at the station after work or stay with a friend, stay with one of the nurses I work with, so that way I don't have to drive as much.
That makes sense.
Yeah.
So you have a partner and a dog at home.
Yes.
So how do they feel about you working extra?
My husband Corbin, he also works for Advent Health now, at the same ER I do.
Oh, that's funny.
Yeah. He works from home. He does spreadsheets and very like smart, high-level stuff that I don't fully understand. Like, he is on Zoom calls, and he works as a corporate trauma registry person, so he helps oversee the data side of the trauma system.
Okay.
At the state level and at the hospital system level. So he does like data analysis, data collection, that sort of thing.
Yeah.
Very like numbers based. Like he's super smart with it.
Yeah.
He sometimes will explain stuff to me, and I'm like, damn, that's crazy.
Yeah.
Let me see that X-ray of that broken leg.
Yeah.
Or that's all I can.
Yeah.
But so he initially worked for a different hospital system, and then I worked for the current hospital system I'm at, and he kind of started not liking his system, more from like a corporate level, because he is a corporate employee technically. So he didn't like their corporate side of things, and so one of my really good friends that I met at the ER, which is another favorite part of my like working there, is like the people that I work with. Like the people are what make it great. If all of my favorite people quit, I'd probably quit too.
Yeah.
Because like they make it so great.
Yeah.
She is our trauma program manager quarter, and she had a registry position open, and so Corbin applied for it. She knew him already, obviously, and he got assigned to half at Porter, half at another hospital that's their sister hospital. So Corbin actually gets to come work with me sometimes.
Oh, that's cool.
Yeah, it's like funny how it worked out. That wasn't the intent. He just was tired of his current position. He would have taken it from our hospital, different hospital, you know, DG University. He would have gone anywhere that was like more conducive to what he was looking for. But somehow it just worked out that he was going to get assigned to Porter.
That's funny.
It's really cool because he dresses business casual for work. He's non-clinical. He used to be an EMT. He understands the ER. He worked in the ER for a long time. Like he has been an EMT. Actually, he just let his EMT license lapse this year. Because it was exactly at the 10-year mark. And he thought that was a good closeout to that chapter. But so we'll come to work together. Because he can work from home or he can work in the office. He likes to come to the office because he likes the people there. And he'll come into the office while I'm on the floor, like doing patient care. And the last time he came in, he had to search for me, and every time he went out to come talk to me, just because he was bored, he'd ask the secretary where I was at, and the secretary would be like, "Oh yeah, he's in the stroke alert. Oh yeah, he's in the cardiac alert." Like, because it was just so busy, and all of my patients were so sick, and so I only got to talk to my husband in the vestibule of a CT scanner reading room because I was just with all the sick people. But
that
it's really
is
cool.
More than most couples, though.
Yeah, it's really funny. Like I loved it. I still get loved when I get to see him there. Usually I don't, except for when he's in his office and I go talk to him. But generally it's not like that. But it was kind of cool just to see us doing our own little, doing our different thing. But doing it together. It was cool.
That is cool. So you mentioned the people, what do you like the most about working in the hospital?
I love that I get to see so much more critical care and just the progression of a patient's care. I love this job. I love taking care of people. I love helping people. I love solving puzzles. It is just so cool to, we talk about getting a differential diagnosis in the field. And then maybe 12 hours later we find out what the patient's disposition was and what their diagnosis was. And we're just kind of like, oh, didn't think of that.
Yeah, we missed that whole gap.
Because we have much less to work with. I get to see such a broad range of diagnostic interventions, and it's so much more it makes me understand more of what I'm doing out in the field. And makes me understand that I don't know what's happening out in the field. I think paramedics, especially with as we get a little bit more technology on the ambulance, we kind of overestimate what we're able to do diagnostically. It just made me realize how little I know of what's going on. And I think that's good, because if you think you know what's going on and you're just super confident about it, you might be wrong. So it keeps me humble, which is a hard thing to do. Keeps me humble, but it's just so much different. Understanding lab work, understanding, and then another fantastic piece. It depends on the physician I'm working with, because some doctors are amazing and just great people, smart, all around good human beings. Most of them are. Some aren't very chatty, some aren't very, they don't want to talk to you. Getting to watch their clinical decision making and understand it. Because there's so much more that goes into clinical decision making than I think we give credit for. We talk about oh yeah, well, this is what the protocol says, but no patient fits squarely into a protocol. So getting to work on clinical judgment, and I get to exercise a decent amount of clinical judgment in the ER. And as you get more trusted and experienced, your thoughts are taken into consideration by physicians. You can suggest things, and I'd say most of the time they're like, oh yeah, that's a good idea, let's do that. It's very collaborative, which is good, because it makes if it makes me think, then I'm not just going to suggest random shit that I read on the internet. Like
Right.
I actually have to think about what's going
Yeah.
on alongside them, and they're very collaborative and getting to just see it through and then kind of apply that in the field. Like I even try to teach it to my crews of just like the small things that we don't think about. Like if you have a patient with abdominal pain, don't put the IV in their hand, because they're going to need a CT with contrast, and a CT with contrast cannot go through an IV in a hand.
Yeah, that's a good point.
Like that's just like a thing that we don't think about because no one's ever told us that.
Right.
There's a lot more that goes into what could be going on, or what we can do just to help, not even immediately change something for the patient, but just help set them up for success in their outcome.
Yeah. Awesome.
So I'd say that's like my favorite part of it.
Yeah, that's cool. So if someone wanted to get into what you do, like as a paramedic or as like an EMT tech, how would they just like apply to the hospital?
It depends on the hospital system that they're nearby. I don't know all the hospital systems that do it across the U.S. I know that our system has a large number of hospitals in Colorado and Florida. So they have, I don't know how many they have around, but I'd say that the number one thing that you have to have before you start is clinical judgment. To some level, you have to be somewhat experienced of a paramedic, because we're not taught in paramedic school an adverse reaction to vancomycin and the treatment for it being red man syndrome, and treatment for it is pausing the infusion, flushing the line, and restarting it at a lower rate. Like we don't know that.
Right.
We would say, oh my God, this is anaphylaxis.
Yeah.
You don't know a lot of stuff. And it made me really realize when I started in the ER how little I knew.
Yeah.
And so if you don't even have the basic clinical judgment of like, I've seen patients, I've seen sick people, I've seen not sick people, I've made decisions. If you don't even have that, then you're gonna really, really struggle.
Yeah.
Because you already have so much to learn when you start that they can't teach you basic judgment. You have to have some level of just good sound reasoning and judgment before you can. So 2 years as a paramedic is generally, I think, what they require. They prefer a critical care endorsement, and that could be anything from like there's critical care paramedic classes that you can take online, like self-paced programs. I would recommend an actual university-based program.
Okay.
I did mine through Creighton. I thought it was fantastic.
Yeah.
It was a semester long. I had a lot of good experiences during it. We had clinical days. Like it was actually, it wasn't just a make money scheme that I think so. When I was researching it, I found a couple that I was like, it just seems like a way for them to make some money.
Yeah.
It was actual classwork, writing papers, reading journal articles, and not just reading the abstract and making like a decision on it. Like actually they're teaching you how to read and understand. Everyone likes to talk about being evidence-based in medicine, how to do that.
Nice.
So that sort of thing. And then I would say making good relationships at the hospital if you transport there and they have that same position, because if they know you and you don't know what you're doing, they're not going to hire you.
Yeah.
But definitely the experiences is something that I think I did work with one paramedic who we thought they had more experience than they did without the endorsement, and after they started, we quickly realized they did not have. They couldn't look at someone and decide if they were sick or not sick.
Yeah, time tells.
Yeah. You can't fake that. So that's the biggest piece.
Okay. So I've heard like a ton of stories from you from the hospital. So what would you say is like one of the funniest experiences you've had?
When the boiler shut down, that's my favorite hospital story.
What happened?
When the boiler shut down?
I don't think I remember.
It wasn't funny, but it was like, I think the best experience I've had there so far, and it's not even related to patient care. So it was the day before Halloween. last year. So it was snowing in Denver. Like, I think there was like 6 inches of snow. I came into work, and for the entire month of October, I wear a skeleton shirt. Because working in the hospital in scrubs, acting like a nurse, everyone calls you a nurse.
Yeah.
And I let them call me a nurse because I don't introduce myself as a nurse because I'm not an RN.
Yeah.
But if someone says, "Oh, excuse me, nurse," like, I don't correct them.
Right.
And so every so often a patient, I wear this skeleton outfit, a skeleton shirt, I'll be talking to someone and they'll ask, "Are you a nurse?" And I respond, "No, I'm a skeleton."
Don't sometimes they think you're a doctor?
They
just
do.
because you're a male?
Especially if the doctor is in the room with me and she is a female.
Yeah.
They will absolutely call me doctor.
It's funny because patients don't care.
No.
They don't care who's what. They just want treatment.
Yeah, they don't, they're not I mean, some of them are, some of them, I had this doctor that I worked with that it couldn't have happened to a better person. But me and her were in the room with this patient, and she was explaining the plan, and the patient nodded his head, looked at me, and was like, what do you think? And I said, "What do you mean?" He's like, "Well, you're the doctor, what do you think?" And I quickly was like, "I am not a physician.
Yeah.
I am a paramedic. I'm not even a nurse.
Yeah.
I drive ambulances.
Yeah.
You should listen to the physician." Mostly because this physician was kind of mean. So I don't want to get yelled at afterwards.
Yeah.
And he was like, okay, whatever. But what do you think? How does that sound to you?
Yeah.
Because he just deferred to a man.
He's probably old school.
He was like 85. Yeah.
Yeah.
He wanted to know the man's opinion, which I did not really like.
Yeah.
I didn't offer my opinion. I said my opinion was that he should listen to a physician.
Yeah.
And a physician standing right in front of him, so I'm going to step out because I just I thought it was really maybe a small little mistake. A little bit later we can kind of joke about it. But it was to the point where I was like, this is not.
I knew you were going to say an elderly male because I've had lift assists where I show up and they're like, no, I want the men. And I'm like, I am just as strong as these guys, if not stronger.
You're stronger than some of them. I mean, not me. I do CrossFit.
Yeah. But didn't you have one story where the lady was missing in the hospital?
Oh my God,
and she
yes.
was calling.
So it was I only work 7 a.m. to 7 p.m. now. I used to work the mid shift, which is either 11 a.m. to 11 p.m. or 1 p.m. to 1 a.m. And this was one of the 1 p.m. to 1 a.m. shifts, which they at one time they were fun. I don't like them anymore. And we had a patient who had escaped, presumably. Yeah. Because someone was calling. It was the middle of the night, and someone was calling phones in the hospital. Yeah. Being like, "I'm drunk and you can't find me." Just calling random extensions. Yeah. And just telling people "I'm drunk and you can't find me." Yeah. And it was coming from internal extensions. Yeah. And so a little bit later there was an overhead page that was be on the lookout for a 60-year-old female wearing a pink dress, intoxicated, running around the hospital. I was like, I love this place.
Did you ever find her?
No, they never found her, but they found her on camera after camera after camera, and she was just doing her thing, picking up random phones, calling random people. She called patient rooms. Yeah. And it was just haha, I'm drunk and you can't catch me. Oh my God. And they did not catch her. She was right. Scurrying around the hospital.
All right, so I have a couple questions that are unrelated to your side job.
Okay.
So what would you say is you've been in the fire service for a while. What would you say is your favorite firehouse prank that you've done or has been done to you or you've heard of?
My top two, I worked with an officer who, I think it was my birthday. He connected what is it called? The fuse for my brakes, my brake lights to my horn in my car. So whenever I touched my brakes, my horn went off. And so I was leaving in the morning and everyone was kind of just standing at the bay doors looking at me.
That's a good one.
And I got in my car, pushed on the brake, and my horn honked. It was hilarious.
That is funny.
Second one, someone who works here actually now that used to work at Fed Heights, older than me. Was at Fed Heights when I started at Fed Heights. Filled my bedroom full of balloons.
Oh.
Like a lot of balloons.
Yeah.
And had like one of them filled with flour.
Oh.
The only way to get rid of 100 balloons is to pop them.
Right.
And so I was just going around
That's awesome.
popping all these balloons. So I was going to carry them all. Like, what was I going to do with all these balloons? And so I went around there popping all the balloons, and I popped one, and it was full of flour.
Exploded.
And just flour dust all over me. That was a pretty good one.
Yeah, that's a good one.
I'd say that's my number one favorite.
Yeah.
You get a lot. Still a lot of
There's
surprise.
like more layers to it.
Yeah.
Yeah.
Like I walk in my room, it's full of balloons. I'm like, God damn it.
Yeah.
So I have to spend all my time popping these balloons, and then, bam, there's the prank.
Yeah.
It's a good one.
Nice. My other question is, what is your weirdest habit?
Oh. I'm addicted to chapstick. Keep that thing on me. I like to the point where I will be able to feel chapstick on my lips.
Yeah.
And I'll still put more on.
Okay.
Because
I get that.
Once I'm thinking about it, I have to do it.
I agree. I'm like that too. And then if I don't have it next to me, like I think about it in the car. Like I have to get it from the car.
But big flex, I run out of chapstick regularly.
Yeah.
Like I use the whole thing and throw it away and I don't lose it.
Do you use it until it's flat, or is it like scooped in?
It's usually flat.
You know when it kind of hurts when the plastic.
Yes. I have so many.
Yeah.
I have like a drawer full of probably like 15 of these. So.
That's a good little gift for you.
Yeah.
And then my last question for you is, what would you tell your younger self? So like you're successful now. You have a great job.
Yeah.
Great life, even though you're 2 hours away. What would you tell your younger self?
I'd say just like just keep going.
Mm-hmm.
Like, because I think there was a time when I was younger that I kind of just had no idea what I was like, what I should do in life or work or anything, and I think I just thought about it a lot, like too much, and so that would be my advice. Just keep on, like stay the course.
Yeah.
Stay the course.
I like that.
Because you put in the work and you stay the course, you're gonna end up where you want to be.
Yeah. Awesome. Well, thanks for joining me.
Thank you.
Do you have anything to add?
No.
Cool.
Thought I gotta sit down and talk to you this morning.
Yeah. Thank you.